At an old horse stud on Queensland's Darling Downs, something extraordinary is unfolding.
We have a reputation at Wagner's of getting things done, and we built the airport in 19 months and 11 days, and we like to do things quickly and get it going.
This is Wellcamp, Australia's first private airport, and soon to be Australia's first privately owned but publicly leased quarantine centre. Why should public money go into a private facility like this?
Well, look, we wanted to build it as quickly as we could, and we wanted it to be of ongoing value.
But the federal government is already building a quarantine centre 100 kilometres away in Brisbane, raising the question about whether the state really needs two.
I find it very hard to accept that a state of Queensland with a lower population and lower incoming passengers than New South Wales or Victoria needs more quarantine beds.
What we have done here in Queensland throughout is ensure that we're well prepared, and having this facility will mean that we're well prepared, and I think better prepared than those states.
The idea of building quarantine accommodation outside of Brisbane was born of frustration.
Mass evacuations of an inner-city quarantine hotel have been taking place throughout the day.
Canberra had effectively delegated its quarantine responsibility to the states. Back in January, Queensland's hotel quarantine system was faltering.
3, 2, 1, go.
This is when an influential Toowoomba family business entered the story.
We put a proposal to the government, a market-led proposal to the government to build a 1,000-person facility here. We felt that we could offer a safer alternative to hotel quarantine, and we felt that at some time in the future would actually help the airport.
The Wagner Corporation is developing an airport, business park and proposed entertainment precinct just outside the regional city of Toowoomba, all with tens of millions of dollars of Queensland government support. What do you think's the secret of their success?
Very, very good negotiators, I'd say.
Larry Pappin's farm borders Wellcamp, and he's witnessed, with growing trepidation, the site's remarkable growth. He was alarmed when the Wagner Corporation succeeded in convincing the federal government to change the original route of the inland rail so that it will now run past Wellcamp Airport, just over Larry Pappin's boundary fence.
Before we've got planes, trains and automobiles now. How much more does one community have to endure?
The Wagner Corporation's latest project, the Quarantine Centre, also had its local detractors, including the federal LNP member for the region.
And as this played out, it became very, very clear there'd been no consultation at all, not with the higher levels of the hospital, not with the police, emergency services. There'd just been no consultation at all.
And the centre looked like it may not be needed when the federal government announced it would fund its own 1,000-bed quarantine facility on Commonwealth land in an industrial suburb next to Brisbane Airport. But within 10 days of agreeing to the Commonwealth development, the Queensland government announced it would be funding its own quarantine facility.
What fantastic value it will be if we can avoid just one lockdown.
It was a very strange jump. The Premier was adamant she needed 1,000 beds. And when the federal government came and gave that, with the Pinkenvale facility, that number jumped to 2,000 with no explanation whatsoever.
For most of this year, Queensland was arguing it only needs 1,000-bed quarantine facility, and then all of a sudden the demands went up to 2. Why was that?
Well, that was, if you recall, that was around the same time as the explosion of cases in other states, and that led to a big surge in demand for our hotel quarantine. I think we peaked at over 3,000 rooms.
By now, the Australian Medical Association of Queensland was becoming concerned about how all these beds would be serviced.
The actual announcement was a bit of a surprise, not only to AMAQ, but to the Queensland Health staff at Toowoomba Hospital and the region itself.
And doctors are still calling for greater clarity from Queensland Health.
in the area I represent in the Downs and in the western sort of corridor, we don't have enough staff to man our own hospitals. So I think it's going to be very hard to find staff for these quarantine facilities when we can't even find doctors and nurses to man our local regional hospitals.
Why hasn't that been addressed?
We will address that in the implementation of how we manage the facility and how we staff the facilities. Toowoomba is a pretty significant hospital, and every time I hear people say that it's not, I get really defensive. It's a good hospital.
But the AMA says there's ramping problems, there's staffing problems, it's struggling with demand already.
I think it's our best run regional hospital.
There's also the question of what happens once COVID quarantine is abolished.
We've got a number of projects on the go. Our Wellcamp entertainment precinct, it could take the total facility. There's inland rail coming through here, so there's plenty of things to do with the facility.
The Commonwealth last week revealed a possible scaling down of its Pinkenbar facility to only 500 beds, which will open months after Wellcamp. All the more reason to build a second centre, the Queensland Government argues. For sceptics, it's a sign Wellcamp may not be needed after all. Do you accept there's a risk this could become a white elephant?
Throughout this entire pandemic, we've made decisions based on being as prepared as we possibly can be. And look, if at the end of the day we don't need this facility for the health response, it has another use, but I'd be really, really pleased with that outcome.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.